10 warning signs of stroke 1 month before. We all know of the disastrous results that strokes may have on casualties and their cherished ones. In any case, are there hidden pointers that might point to an inescapable stroke up to a month in development? This video will show these extraordinary early caution markers and emphasize the need to identify them. So, let's get started immediately. Sign 1. Sudden and unexplained weakness. One of the most punctual signs of an approaching stroke is sudden and unexplained weariness or fatigue. It's essential to avoid dismissing feelings of excessive fatigue, especially if you experience it after a decent night's sleep. Pay attention if you are feeling tired in an unusual way because your body may be attempting to caution you of a more impending severe issue. Sign 2. Persistent headache. Another notable symptom to look out for is persistent migraines. While headaches are regular and usually harmless, severe, constant migraines can indicate a root problem, such as the possibility of having a stroke. If you are experiencing repeated migraines that are not normal for you, it is essential to have them evaluated by a clinical professional. Sign 3. Vision problems. One of the early side effects of a stroke can be changes in vision, like sudden blurred vision or difficulty concentrating. See an eye doctor or healthcare professional if you are experiencing bothersome visual effects that have never occurred before. Remember, it's smarter to protect than to heal. Sign 4. Speech and language difficulties. Language or communication problems can also be an early sign of a stroke. It is important to seek reliable clinical support if you or someone you know suddenly has trouble finding the right words, has difficulty speaking, or suddenly feels unable to understand others. These communication problems can be an early sign of a stroke. Sign 5. Sudden dizziness and loss of balance. Sudden drowsiness and loss of balance are two of the most problematic symptoms. You mustn't ignore these symptoms if you feel unusually jittery or dizzy. Loss of balance without an apparent cause could be a sign of a stroke. Sign 6. If you experience numbness or weakness in your face, arms, or legs, it may be a cause for concern. One of the most apparent symptoms of a stroke is the sudden or unexpected weakness of muscles in the face, arm, or leg, particularly on one side of the body. Act quickly and contact crisis management if you experience a sudden loss of sensation or sense decline in any of these areas. A quick clinical analysis can significantly influence the results. Sign 7. Severe and unexplained mood swings. Severe mood swings that occur frequently and for no apparent reason can indicate an impending stroke. It's important to avoid blaming sudden, unexplained mood swings on external factors if you or a loved one experience them. It is essential to seek reliable clinical judgment to eliminate the possibility of a stroke as an explanation. Sign 8. Sudden change in personality or behavior. It is important not to dismiss sudden and unexplained changes in personality or behavior, as they can indicate emotional episodes. It is essential to seek advice from a medical professional as soon as possible if you or someone you know exhibits unusual behavior or personality changes. Early intervention can prevent a major stroke. Sign 9. Unexplained chest pain or palpitations. Although chest pain is commonly associated with heart disease, it can also be an early indication of a stroke. It's important to seek adequate medical attention if you have chest pain, chest tightness, or a loose pulse that is sporadic or unexplained. Remembering that chest pain should never be overlooked or dismissed is crucial. Sign 10. Transient ischemic attack, TIA mini-stroke. Ultimately, experiencing a transient ischemic attack, commonly called a mini-stroke or TIA, is a significant warning sign. A TIA refers to a short-term disruption in the blood flow to the brain that typically only lasts for a few seconds. These episodes usually occur before an actual stroke and require immediate clinical care. Never ignore these warning signs because they can save your life. This concludes our summary of the 10 warning signs of a possible stroke a month before a real event. Remember that recognizing these early signs and getting a physical examination are key to preventing a stroke. Contact crisis management immediately if you or someone you know experiences any of these symptoms. Please prioritize your safety and take care of your health.